I had always, listened about, heard about speed from my seniors who have cracked, and also the NEET entrance exam. Speed subscription, I took it 25 days prior to the exam. Just one step above everything else, which I had gone through prior to that.
So I bring in all the wishes and greetings on behalf of the entire faculty team and the team of Speed to Dr. Amartya Sengupta for scoring AML rank 2, CML rank 2 in the specialty of MCH Neurosurgery, INISS session October 2024. Congratulations and best wishes to you.
Thank you so much, sir. And the feeling has sunk in finally, and feels great, honestly. Thank you so much for having me here, sir.
Great. Wonderful. And can we know a detailed background of yours from where you started till date, what all you have done?
Surely, sir. Sir, currently I am in my third year of postgraduate residency, MSc Neurosurgery. I actually have my practical exams in the next week.
Before that, you have a seat in your hand. What to do?
Exactly, sir. So, and I'm pursuing, or if I can say, I will be completing my MS from IPGMER and NEET Hospital, Kolkata. And neurosurgery has always been some sort of a dream for me ever since my MBBS days. And I actually had a chance. Funny thing, I actually had a chance to get into the 6 years course during my PG itself. But I don't know, I was sort of, maybe I was a bit demotivated by some people, somewhat I got discouraged and I just, opted out of it at that point. But, during my PG, after attending the rotational postings and all, I really felt that there is no need to be worried. This is the only branch I would ever, pick up in future. So here I am, sir, and it really feels great.
Great. Now, can I know how did you prepare? What are your strategies of preparation? What did you do to achieve such a rank even before completing the residency?
Surely, sir. Sir, I'll be very honest. If I were to say that exact duration of my preparation, like fully focused preparation, it could be around 3.5 months. Fully focused preparation for my INISS would be for 3.5 months. And during that time, what I did, my strategy was mainly to focus on grand tests. This is something which I have been doing ever since my UG and PG days. So I always believe that, studying and mugging up content, that is fine, but it should have an end product. So the best way to test yourself out would be to give grand tests continuously and rigorously. So initially, my frequency of giving grand tests would be, say, once or twice in a month. And as the date of the exams, as the date came near, I would increase my frequency to say initially from twice in a month to twice in a week. And in the last month, I used to give one grand test in every alternate day. One grand test every alternate day. So in the past month, I would say I completed around 18 grand tests. 18. And that would be, I would say, the main source of my preparation and the main reason of my rank. Apart from that, when it comes to content, I would say I did go through Greenberg. I mean, it's quite a lucid book. However, it's very... it doesn't have much of concepts. It's very textual, I feel, and it's mainly sort of a rapid revision kind of book. So for concepts, I would say initially, one funny thing is that initially I thought that Greenberg would be enough, right? But then I realized, okay, let's take up speed. I had always listened about heard about speed from my seniors who have cracked and also the NEET entrance exam. So I do believe I was somewhat a bit late when it came to taking up the speed subscription. I took it 25 days prior to the exam. And honestly speaking, after I got into enrolled myself in the course and opened the app, I was honestly a bit shaken because I found that it was completely based on humans. And just one step above everything else, which I had gone through prior to that. So honestly, it felt really good. Okay, fine. Now I don't have to worry about content at all anymore because honestly, there is nothing else that would come out of this at a SS entrance exam level. So, however, the syllabus was a bit bulky, but one game changer would be, I would say, the e-notes. the eNotes by Speed platform, even if I don't, even if someone doesn't have the time to go through all the videos, if you have some sort of a background in neurosurgery, if you have probably read some amount of neurosurgery prior to taking a speech situation, I would say you can use the eNotes to get by, and it's actually very high yield. First of all, it's very lucid as well, very concise, and it hits all the important points right at the go. So I used to use my eNotes regularly. I used to finish say 4 to 5 chapters per day. And I ensured that I would complete the entire syllabus by 14 days, whatever is there on Speed, so that I can revise once more before my first part one, that is theory exams. So that would be all. To sum it up, frequent grant tests, the Speed grant tests, I would say they are very realistic. They're very close to the actual paper. Nothing out of the box, but at the same time, it's a well framed mix of questions from easy to moderate to hard, exactly as appears in the final paper. So that actually gave me a realistic point of view as to how the paper really is and how I am currently performing and how I should be performing on the day of the finals. So giving frequent grant tests and utilizing my eNotes from Speed, and also sir really taught a few topics very well, which I had some confusion about prior to taking up Speed. So I really have to thank my professors from neurosurgery, Sivan sir, and I really looked up those videos, especially the latest updates, I would say, based on vascular neurosurgery, neuro-oncology. Everything is so well ordered and organized. I did not have any problem in scouring through the entire course. So a mix of eNotes and a bit of videos, and mainly my grant tests. And I would say I could only give 2 revisions, a total of 2 revisions prior to giving the final exam. So that would be, I think that was enough, apparently.
Good words, sir. In faculty of Speed and team of Speed will be happy to listen to your video. It's full of appreciation and positivity. So end of the day, results matters, right? So end of the day, results matters, and seeing students being successful after the course is over, that's what everybody sees. I mean, where there is a reflection, see, we study, we prepare in one perspective, and the exam when happens. I mean, on the day of the exam, you felt, okay, this paper is to my preparation. I mean, I think I have a play in this paper. Did you have that feel during writing the exam? After the results, we could understand. But during the exams and just finishing the exams, did you feel that?
Yes, actually, honestly, I heard that the previous paper, that is a May session paper, was comparatively tougher compared to the recent years. However, this particular paper was, I would say, a very standard and balanced paper. And the funny thing is that the questions that were asked were nothing out of the box, nothing, nothing of a very high level. But the questions were a bit tricky, and all these questions are actually past questions, or questions from related topics. I could really make it out. But the question was framed in such a way, and the options was a bit confusing, as it is always the case with INI. However, it was, I sort of had a confidence that, okay, I do know all the topics. Nothing is new to me. So let's just concentrate, let's narrow down my options, narrow down the possible options, and just mark it correctly, and just keep a cool mind and go with it. Initially, it was a bit, I was going a bit slow. However, the general surgery paper was a bit easy this time. It was actually very, I personally, I felt so, I'm not sure. But the neurosurgery paper was a good mix, I would say, a good mix of standard questions, moderate to hard questions. And again, easy questions as well. But again, these easy questions are also direct questions where you might make silly mistakes. And I am guilty of making a couple of, not even a couple, I'm actually guilty of making a lot of silly mistakes. So that was something I felt really bad for at that point. I was like, okay, let's see what happens, how it pans out. Hopefully, panned out well for me. I was lucky, I guess.
Very good. Great. Now, time to thank whom all you want to thank. You can use this platform to do so.
Yes, sir. So obviously, the entire Speed team, so you yourself, your videos really, help me out with planning on the preparation. As you said, revisions are very important. And you also mentioned that grant tests, there are so many grant tests in the Speed app. So I really, utilize all of that, or whatever I could in those span of 25 days. And apart from that, definitely my professors from neurosurgery and sir has taught wonderfully. The app, even the app is very lucid and very It's very easy on the eyes. It's very easy to access. Everything's very structured and organized, and there's a lot of options actually. So I reckon it would be best if one starts the speed preparation a bit early, because you have a lot to cover. And at the end of the day, you don't want to just go about grabbing up and gathering new material. That is something which you should not do. You should stick to the material that you have already read and revised. So to cover speed very effectively, I would say take it up at least 2 months prior to your exam. So that would be even better. You can utilize everything the speed has to offer, and so you won't have any let's say drawbacks or weaknesses when you're going to earn the paper. Apart from that, so definitely my parents. They have always been by my side. I obviously I can't thank them enough. My professors from my college, they have always been very supportive of me in whatever I've been doing. And my friends, my colleagues, everyone. So everyone has a say in my success.
Okay, great. What is that advice you want to give to the aspirants of neurosurgery for future aspirants?
Firstly, I would say the problem about neurosurgery is that it's not like your GI surgery, or it's not like your surgical oncology. Honestly, we are well acquainted with GI surgery and surgical oncology. At one time, I would be very honest, I used to give random mocks of GI surgery just to check my MS preparation. I used to get rank 1 in those mocks.
Oh.
So the funny thing is that these streams, you sort of have an idea about what you're going to appear for, right? Because it's very similar to our MS curriculum. But neurosurgery is a completely different branch. It's honestly, most of us don't have any experience or any exposure. Most of the people don't have any exposure to neurosurgery during our MS. Not that much of an exposure. So I would say start a bit early. Say in the third year of your preparation. I mean, in the third year of your MS. Obviously, focus on your MS first, definitely. But at the same time, start reading. I would say Greenberg is sufficient initially as a baseline. Go through the main topics such as your neuro-oncology, vascular neurosurgery, apart from that, and general neurosurgery, very important. The basics of neurosurgery. They love, teams just loves asking questions on general neurosurgery as well. So, and infections, all of these hydrocephalus, these are the high-yield topics which you must read properly and read from a textbook. Greenberg, I would say it's a pocket-friendly book, so you read that. And then you take your subscription, whichever subscription you want to. I would say, I would be honest, you can take multiple subscriptions and just give as many grant tests as possible. Just give grant tests. Don't worry about your preparation. Just see where you lie. Actually, MCQ exams are a bit different from theory exams. You need not know the correct answer 100%. You just have to mark the right option. You have to rule out the other options. So try, practicing in that way. Try to rule out options. Try to read between the lines and try to see what the examiner wants to ask you, or how the examiner might want to confuse you. Every hint is there in the question itself and in the options itself. So try to get into that habit of cracking down MCQs, and you can only do that by taking multiple grant tests and solving multiple QBanks and multiple questions. So start testing yourself from an early stage itself. And then apparently, when it's 4 months prior to the exam, I would say 4 months is sufficient. You start with the revision. At least revise 3 times. 3 times, I would say, is safe. The entire syllabus. And you revise also the bookmark questions that you made mistakes in. I mean, and most of the times, we'll find that those are the questions which turn up in the exam itself. And this happened this time as well. So there were a couple of questions I used to mark incorrectly. Unfortunately, marked incorrectly in this session as well. So that didn't help me much. But that is what I want to point out. Keep on revising your bookmark questions as well, because you never know, they might turn up in your exam. So that is how you sort of hide your flaws. And just, I would say, in the last month of your exam, give at least 10 grant tests. That would be the minimum grant tests you should be attempting. And on the last day of the exam, don't leave anything. Just sleep, have a nice sleep, and just on the next, just go ahead and be at your peak physical state. That is the most important, because everything depends on the particular day. You might be getting very high ranks in your mocks. You might be getting first rank in all of your mocks, but on that particular day, something might happen and you sort of might fall off your standards. So make sure you're in your peak physical condition. That is something which is very important. So that would be my gist of the strategy which I would like to give out to my fellow aspirants.
Great, doctor. So I once again wish you all the best and all the success for a great and wonderful career in the specialty of neurosurgery. Best wishes to you, doctor.
Thank you so much, sir. Thank you so much for having me, sir. And once again, thank you to the entire speed teams. Thank you, sir. Take care, sir.
Thank you, doctor. Thank you.
Thanks.